We're going to start with any requests for committee sponsorship of bills. I thought we had one request. Excuse me? Do we have any committee bills? No? We'll take them from the audience. Thank you.
Mr. Chairman, members of the committee, I'm Whitney Dameron, appearing on behalf of the City of Topeka. I confess I haven't spent much time in front of corrections and juvenile justice as a lobbyist, but I didn't as a minor either, so catching up just a little bit here. City of Topeka requests introduction of 25 RS 0670, which would allow a person aged 20 years and older to essentially become trained as a law enforcement officer, enter the Kansas Law Enforcement Training Center. They would still have to be 21 years of age before they could be commissioned as a law enforcement officer in our state.
Are there any questions from the committee? Any objections? Yes, Representative Carmichael.
I believe traditionally matters involving law enforcement qualifications in Kansas have been handled by the judiciary or even federal and state affairs. Why is it you appear in front of the Corrections and Juvenile Justice Committee with this legislation as opposed to other committees where this type of legislation has traditionally been heard?
Don't think we've seen this particular one before. Quite frankly, we were comfortable going to either committee. I approached the chairman and asked if it'd be appropriate to bring it to this committee, and here we are. It could be assigned once introduced to judiciary.
Right.
We would not object to that.
Good, because I will use what little influence I have to send it somewhere else. But I do not object to the introduction. Thank you, Mr. Chair.
Okay, with that, we'll pass it on to the floor.
Thank you.
You're welcome.
Thank you, committee.
I wanted to let everybody know, I think I've told most of you individually, we will not be meeting tomorrow, Friday. So I know that will disappoint many of you, but that's my decision and I'm sticking with it. Okay, so we have two guest speakers today. I believe we should first hear from Stephanie Uberall, the Deputy Director, Council of State Government, State Justice Center. Welcome to the committee.
Hi, everyone. I'm Stephanie Uberall. I work for the Council of State Government's Justice Center. And I'm here to talk to you today. You're going to get my slides up there. That's okay. Sure thing. Take your time. I'm here to talk to you today about a collaboration between a few state agencies to help improve behavioral health outcomes for young people that are experiencing the justice system or at risk of justice involvement. I gave this presentation to the Joint Committee on Corrections and Juvenile Justice back in November, but I was invited back for today, so I'm really grateful to be here. Okay. So our initiative is called Stepping Up for Youth, and I'm going to share key findings and recommendations from a state assessment we did over the past year or more with the three agencies that are a part of this initiative, which is KDOC, KDADS, DCF, and also OJA. So just some framing. We have three main sections of the presentation. So first, I'm going to provide a brief overview of the initiative and then move into the key findings from the assessment and then share the recommendations for improvement. And I know that we're splitting time, so I'm going to kind of like speed through some of these background slides here. But the Council of State Governments is a national nonpartisan nonprofit, and we work with states and counties across the country to help improve outcomes around public safety. And on our juvenile justice team, the green squares or whatever shape that is the states that we've worked with. And this is also in partnership with our behavioral health division within the Justice Center. And so critically important is that Kansas is the first state in the country to develop a Stepping Up initiative for youth, and we're really excited about this partnership, which builds on an adult-focused effort that we work on with Kansas, which is focused on keeping adults with serious mental illness out of jails. And so we've expanded that concept to the youth space, and we currently operate a technical assistance center in Kansas for jails and counties across the state, and are modeling our youth initiative off of this work. And so here I'm going to provide a quick overview of the initiative and our process. So the goal of this initiative, like I said, is to help improve behavioral health outcomes for young people either involved with or at risk of involvement in the juvenile justice system. And our core agencies are KDOC, DCF, and KDADS, really in efforts to promote cross-systems solutions, and we really appreciate their leadership. And so in order to ensure we're working comprehensively, we are working at both the state and local level, where at the state level, we conducted an assessment of policies, practices, and funding mechanisms across state policies. And at the local level, we will be standing up that technical assistance center that can support counties in implementing best practices and any new policy changes that stem from this work. Oops. And so we had 5 key phases across the state assessment, and I'll talk about these in the next slides. So we had a state task force that guided this work, which included elected officials, the governor's office, agency leadership, judges, agency leadership at the state and local level, law enforcement, advocates, people with lived experience, and others. And so as we went about this work, these were some of the guiding questions that really the task force considered. So, what behavioral health services are available to young people? How do various juvenile justice policies account for behavioral health needs? Is there effective cross-system collaboration? Are resources being utilized efficiently? And are data being collected and used to help improve system performance? And so over the past year or so, we have engaged in a variety of activities to inform this state assessment. So we engaged in system mapping across the 4 agencies that I mentioned, KDOC, KDADS, DCF, and OJA, to really understand what policies, practices, quality assurance mechanisms are in place at the intersection of juvenile justice and behavioral health. And we also reviewed, aggregate data and reports, and we hosted listening sessions with more than 120 people across the state to really understand their ideas around improvement and things that are working well. And so to ensure we were really working comprehensively, we examined this continuum of where juvenile justice and behavioral health intersect. And you can see we spanned everything from early intervention all the way through reentry from state facilities. And so the first key finding from our assessment is that many young people in Kansas have behavioral health needs and are pushed into the juvenile justice system really to receive services rather than because they are a public safety risk. And so to share, and just frame up some of the behavioral health indicators we found is that we see that young people in Kansas are really struggling with their mental health. Nearly half of girls are feeling sad for 2 weeks or more, which is an indicator of depression. And, we see that 13% of boys have really seriously considered suicide. And across the country, we find that young people are often referred to the juvenile justice system in order to get their behavioral health needs met. And while Kansas young people are faring a bit better than the national average, which is the gray bar, Kansas is the blue bar, these data are still a call to action for us. And here we see that many young people in Kansas have behavioral health needs that put them at risk for needing crisis intervention services, where 9% have a substance use disorder, 13% have considered suicide, and 4% have attempted, and 12% of young people have a serious emotional disturbance, which is like a serious mental illness, but in youth terms. And then we found that youth that don't really have sufficient access to community-based care without system involvement. So here you see at least 2/3 of young people in Kansas had a major depressive episode but did not receive mental health services. And so in looking at arrests, we see that the vast majority of youth arrests, 77%, are for non-person related offenses, and only 5% were violence related. And then once young people are placed on probation, we see that the majority of youth have either low or moderate risks to reoffend. And given the research that demonstrates poor public safety outcomes and youth outcomes for low and moderate risk youth when they're processed in the juvenile justice system, it really offers an opportunity to reflect if some of these young people might be better served through a community-based diversion model. Our second key finding was that Kansas lacks a coordinated statewide cross-systems approach to community-based services used efficiently. And so before I kind of jump into some of this, I wanted to really highlight that Kansas has a really strong foundation that we can build upon to strengthen youth behavioral health outcomes and public safety. And these key elements you see on the screen, like I said, are a really strong foundation that we don't see in a lot of states and offer an opportunity for expansion to develop statewide approaches. And so throughout our listening sessions with stakeholders across the state, we heard about key gaps in services for youth with behavioral health needs. Stakeholders noted that there's not comprehensive targeted services for young people with behavioral health needs and justice involvement, and that funding is not being spent or maximized, and there were service slots that went unused. And when we see services that do exist, like respite, it's not scaled statewide. These can have long wait lists and include eligibility criteria that might exclude young people with justice involvement. And so all of this really leaves key gaps in services for youth across a wide range of needs, including like intellectual developmental disabilities, conflict mediation, substance use, approaches for young people that run away or don't go to school. And so then we took the steps of reviewing state statute and policies and funding. And while we found there are those key elements I referenced, many of these are not statewide and lack intentional strategic development or authority around implementation to really ensure there's a continuum of services. And as a result, not having this intentional authority or coordination or utilizing data to inform policy decisions, we see gaps in services and young people's ability to access these services. And so this is also a significant concern for rural and frontier counties that cited significant access issues with their community mental health centers, and they did not have resources to effectively meet youth needs. So while we've seen investment in some of these foundational elements, they're not scaled or coordinated under an overarching strategy or authority to ensure effective implementation. And so to dig into the funding a little bit more, we see that state funding is being allocated for behavioral health services, but is not being utilized and may be at risk for being returned to the state general fund. And so we really want to ensure that this funding that was intentionally put aside is used effectively for behavioral health services. And then also at the state level, there are contracts, but these are not being maximized. So you can see nearly all of these line items, except the sex offender services, were not being expended. And as a result, we have service slots that are being unused, even though there is a need for services. So there is a mismatch. And Medicaid is not being utilized for evidence-based services that we know are effective for young people. So really just highlighting that state and local coordination can be further enhanced by developing an authority and specialized approach for young people that are involved in the juvenile justice system and have behavioral health needs. So our last key finding is that young people are ending up in detention or correctional facilities, which are expensive due to the lack of community-based services, and there's a lack of consistency in the services they receive in these facilities statewide. So we found that Kansas lacked a statewide approach to detention oversight. All of your detention facilities are run and funded locally, including formal alternative to detention state policies or guidance, especially for young people with behavioral health needs. So you did have a statewide detention screening tool, and you do have some counties that operate, various alternative models, but there's no requirement for jurisdictions to develop these formal alternative to detentions. And there has also been investment made to establish crisis intervention centers as an alternative to detention for youth with behavioral health needs, but these have not yet been implemented, and they also will not be available for youth statewide. So as far as state oversight of juvenile detention centers, currently DCF licenses these juvenile detention centers, but really around like basic health and safety. And next year, there's an option for juvenile detention centers to participate in performance-based standards with KDOC, but this is voluntary and not required. So really want to consider how we can include a review of data that would take into consideration behavioral health indicators to advance our ability to serve these young people effectively and strengthen public safety. And so now, looking at the use of detention pre-adjudication, which is like pretrial in youth terms, we see that Kansas has reduced the use of detention, but it is still 88% higher than the national average. So Kansas is that blue line. And then to dig into who these young people are that are detained pre-adjudication, we see that more than a third of young people that are in detention are there for a non-person offense or a technical violation of their probation or a status offense, which is like running away from home or not going to school. But more than half of young people that were detained had a person-based offense. And then to dig into the question of who is being committed to the juvenile correctional facility, we see that some of these young people might have been able to be maintained in the community. So almost 2/3 of youth in KJCC have low and moderate risk to reoffend. So while the majority of these young people have committed a person-based offense, they are also low and moderate risk. So it presents an opportunity to examine what's driving some of these decisions around committing a young person to a state facility, and how we can better meet their behavioral health needs in the community, either before or after incarceration. And so we also found that most youth committed to KJCC have significant behavioral health needs. 77% have a mental health diagnosis, and 43% have a significant mental health diagnosis and require individualized treatment. And 41% of young people are taking psychotropic medications. And stakeholders within KJCC really emphasize that many of these young people did not receive the early interventions that could have prevented the escalation of some of their behaviors and risks that keep them out of the facility and in the community. And so lastly, in this section, we found that there's a lack of state policies and funding to ensure young people maintain continuity of care while they are in detention and upon reentry from KJCC. So there's a lack of statewide policy around community mental health centers' ability to see clients when they are detained, and this really disrupts their care and the progress that they're making because their Medicaid is suspended. In 2025, which is now, there is a new requirement around reentry planning for youth when they leave a facility. And so we're looking forward to seeing how that policy will be operationalized to help really promote young people's ability to access behavioral health services when they leave a facility. And while young people receive behavioral health supports while they are in KJCC, not all young people receive aftercare. In statute, only certain youth are required to receive aftercare, and it's based upon their offense and not their needs. And stakeholders discussed how that many young people that are released without this proper care really cycle back to KJCC as a result of their inability to get services while they're in the community. And so now I'm going to talk about some of the recommendations that stemmed from the task force and are based upon the state assessment that we did. So just some context of how we got here. After we presented the key findings to the task force in September, we drafted a set of recommendations that we really vetted with the various agencies that are leading this work, including both large-scale improvements and more discrete agency-specific items. And so this was vetted, and we prioritized the list with the secretaries from KDOC and KDES and DCF. It was also reviewed by the Chief Justice and other additional leadership from the various agencies, who then, helped us develop a set of recommendations that they got behind, and the task force voted to approve all of these recommendations back in November. So we have 2 large-scale improvement efforts that are part of our recommendations, and they're more detailed than what's up on the screen, but just for our sake. So the first one is around developing an early intervention system for youth. So for both of these large-scale items, we are looking to obtain executive orders to help promote a planning process to ensure we're developing intentional solutions. And so looking at a planning period around 12 to 18 months across the various agencies to really, make sure we're not rushing to solutions for these big items. So the first is really around, like I said, developing an early intervention for young people, which would be led by KDADS in collaboration with DCF, KDOC, OJA, and other stakeholders. And there are like 3 or 4 main goals here. First is to strengthen that cross-systems collaboration on crisis intervention, assessment, and case management, and then around quality assurance, including developing clear authorities across the early intervention system. The second is to scale and strengthen new and existing community-based interventions statewide, including leveraging and coordinating the various funding streams like Medicaid, state and federal funding, and also reduce the risk of court involvement for low-risk youth and youth that commit status offenses, which is like running away from home and not going to school. And the third is to address gaps in capacity and the workforce to ensure there is actually staff to provide these services, especially in rural and frontier counties. Our second large-scale improvement is focused on establishing statewide detention standards and quality assurance mechanisms. So KDOC will lead this effort in collaboration with the other agencies. And the goal is really to ensure that detention is only used for young people that are public safety or a flight risk, and that young people in detention receive the services and supports they need to reduce their risk of reoffending. And really to promote detention facilities across the state and adopting a minimum set of best practice standards, receive the supports and trainings that they need, while simultaneously maintaining their local autonomy and discretion. And this can include things like developing oversight structures, training and best practice standards, things like screening and assessment, education requirements, family engagement and reentry planning, and ensuring that there are alternative to detention options for young people that don't meet the threshold of needing to be detained. And then moving into the more discrete recommendations, I have 4 of like the 8 that we have, really around promoting. One is adopting the mental health intervention team into statute. So this is currently led by KDADS. This is a mental health program in the school that helps young people get connected to the CMHCs, the community mental health centers. And then the other 3 are really for KDOC and OJA around standardizing the immediate intervention plan, which is diversion. So if a young person is low risk, and currently in statute, young people's first misdemeanor is required to be diverted, and jurisdictions have the option to divert any misdemeanor that they'd like. Another is around developing a specialized caseload and approach for young people with behavioral health needs once they are under supervision with community corrections or court services. And the last one here is around requiring care coordination for team meetings for young people at risk of being placed in KJCC to determine if there's another option available for them. And then some of the other ones are really around data, quality assurance, collaboration across KDOC and OJA, given you have 2 supervision agencies in the state. And just before we kind of move into questions, I just want to share some of our next steps. So like I said, we are seeking executive orders for those 2 large-scale changes, which are the early intervention system and detention standards, where we'll be developing 12 to 18-month action plans around these recommendations. And we'll be, we're hopefully reporting back to you all and looking for your support around implementation needs. And we don't know what those are yet, but as we form this plan up, we'll have a better sense of what some of our legislative needs might be. And so I know I went through that pretty fast. I didn't have a lot of time, but I want to just pause and see if you guys have questions or.
Well, thank you very much for your presentation. And I will call on my ranking, Mr. Schlingensieben, for a question.
Stephanie, thank you for your presentation. I particularly, given this presentation, really enjoy the fact that your German last name means everywhere, which I interpret to mean comprehensive. And I have just a couple of questions for you. Thank you really for your presentation. I have just 2 questions. One is, you talked a little bit about allocation, what was awarded and what was expended, and showed a gap there. And I was just curious, is that gap explainable by the fact that we don't have kind of enough services to really cover what we hoped we could cover? I mean, that there's a gap between funding and ability to utilize those funds?
Yeah, that's something that we're digging into more. During our listening sessions with folks, a lot of it stems from not having an adequate relationship or services with the behavioral health provider. So without services, it's hard to fund something, right? And so part of our work around the early intervention system planning is how do we help make some of the behavioral health centers more youth-specific. There's no requirement right now to have like a youth-centered model or approach. So that way, some of this reinvestment money can be utilized like specifically with young people in partnership with the local community mental health center.
And then if I may follow up with just one, and that was with another question. On your key assessment findings, number 1, that was on slide page 13, you wrote, many youth in Kansas have behavioral health needs and are pushed into the juvenile justice system primarily to receive services rather than because they're a public risk. When you say pushed, I mean, I assume that someone ends up in detention because either they've been pre-adjudicated or they've been adjudicated to be there. So they must have committed some crime, right? I mean, in order to end up there, or are you saying that that because of inadequate mental health treatment, some of these folks have resorted to behaviors that have gotten them there? I just really didn't understand the slide.
Sure, yeah, no, it's a great question. So in Kansas, you guys have something called a juvenile intake and assessment system, and this is kind of a law enforcement drop-off, right? So if I'm a parent and I'm having a conflict with my child, I call the police, they show up, and we then go to the Juvenile Intake and Assessment Center. And so this is the first touch point of the juvenile justice system. And young people can be arrested for assault if they do something even in the house, right? So you might have an offense, but is it really a public safety issue, or is it a behavioral health need or a family conflict need that's driving this justice system contact? And when we looked at some of the intakes at the GIACs across the state, I think it was only like 15% of young people that came to the GIACs had like a felony offense. And so you're really looking at a large number of young people that are having justice contact for like non-significant public safety concerns. And so if a young person is detained, that's a deeper system involvement versus, coming through the GIACs and being placed on supervision for a year or however long, and having then like more system involvement for things that could be resolved in the community when there's really not harm happening to the community. It's either, something going on with the kid. So we see this across states and counties we work with all the time because there's not a strong youth behavioral health division or approach, that young people are ending up in the juvenile justice system and their main need is like a mental health need or a substance use need. And how can we, really divert that and make sure young people are receiving services without then this other system involvement, if possible. So.
Thank you. Thank you, Mr. Chairman.
Thank you, Mr. Chair, and thank you for the presentation. I guess my question would be on, when you're talking about the status offenses, such as when a child's a chronic runaway, for example, you're just referring to you don't want them in detention in GIAC, not secure placement, right? You're not advocating against secure placement, are you? If a child's a chronic runaway and they keep running away from their foster home.
So the research shows like any type of placement is, we would rather keep young people in the community if we can. It depends on what's going on for them, right? So Kansas is already ahead of a lot of states where these young people that commit status offenses are routed to DCF rather than the justice system. So, but they still go to the GIACs, they can still have other types of justice involvement, and we really want to promote like family-centered solutions for those kind of behaviors. So, because even kids run away from placements, like a lot of those are residential, non-secure placements, so they can leave there too. So part of it is, how do we ensure we're developing a service continuum that takes into consideration that need, because those young people may or may not have a mental health need, right? And so then they're not eligible for being served at their community mental health centers, but there's not targeted services for those kids. And so when we're thinking comprehensively about how do we keep kids at home, out of these systems for some of these behaviors, we really want to stand up specialized services to address, like, why are you running away, rather than now I'm DCF involved, or I don't think we can detain kids for status offenses here anymore. So there's movement around policy, but it's just, how do we implement community-based services for those kids?
May I follow up on that, Mr. Chair? Thank you. And thanks for that. I just want to make sure that we still have the option, because we're lacking in Kansas for secure placement, because we have kids who are hooked on fentanyl, who are involved in trafficking here locally, and they keep running away, no matter where we put them, and it's not safe at home. So just, I want to make sure we keep that secure placement available. Thank you.
Thank you, Mr. Chairman. I have a question. It's a little bit of social economics. So in Kansas, we have an expanded Medicaid, and there's about 45,000 kids that would fall in the Medicaid expansion space. So how many of the children who are now getting the early intervention, that means they're already in the system, would have had access to health care if we had expanded Medicaid? Is there like, do you have social economic status numbers?
Don't have that data available. We could see if people have that. I mean, there are conversations about kids that are not insured, underinsured, even private insurance. They're not eligible for certain things that Medicaid covers. So I don't know.
Are there numbers that can compare us to Medicaid expansion states? Because you said that we're 88% higher than, I believe, I'm trying to find the slide, but yeah, we're 88% higher in incarceration.
Around detaining kids pre-adjudication. So their Medicaid eligibility is not an indicator on the detention screening
Okay.
tool. So it wouldn't factor in. Does it factor into like a broader environmental?
Okay.
Of course, but not on like detention direct decisions.
Okay, thank you. Thank you, Mr. Chairman.
So just define to me, because behavioral health services, so what's that mean to?
Yeah, so that is mental health and substance use treatment. So if I have anxiety or I'm depressed, if I have early warning signs of bipolar disorder, if I'm using marijuana or other drugs, those types of services are available.
Mr. Chairman, just one more follow-up. So a lot of kids before, and they're starting to, their parents have given up, or they just can't control the kids, or whatever problems. I mean, it could be a number of things that happen. They end up in the hospital, but they have no medicine, or they don't have no insurance, and maybe it's eating disorder even, or something like that. So they go to detention, or they go to the hospital, they get kicked out because they have no treatment. And then you're saying that they act out and they get put into this. Is there any consideration for privatization of contracting with those type of homes that would take care of those kids and people that, I mean, you can do it if you have money. But if you don't have money, have we talked about anything, programs for that?
So part of what we're looking at right now around the early intervention system is what community-based services exist right now and what are the gaps. And there are some big gaps for some of the things you're talking about, like family conflict, running away, things that are early warning signs, right? So like I said, the research really shows us that like as much as we can keep kids in their home, in the community, the better, because those residential placements are artificial environments. The kids are going to come home and then have to address all the same things about their family, their community, and their behaviors and the school. So we really try to promote how do we build the skills and strengthen a young person's ability to be resilient in their family and home. So I don't know if that answers your question.
That's fine. Thank you. Thank you, Mr. Chairman.
Thank you, Mr. Chairman. Thank you for your presentation. And I was part of this committee, although I missed a couple of meetings because of my email was down. But in 2000, there was a program, a restorative justice program, where it was a partner program with the District Attorney's Office Juvenile Division. And I was a program coordinator, trainer, facilitator with that program. And we worked with youth who committed low-level crimes. It was part of their diversion. It was voluntary, but are you aware of that? Are you familiar with that?
Not that specific. I don't.
Okay, and we use I may have said this already. We use the family group conferencing model, which it allowed for a meeting between a victim and an offender, all stakeholders, from communities, from schools, whoever had any stake in this young person's life, to really have a conversation and identify what led to the behavior that caused him to commit an offense, him or her. So we had a 97% success rate. 79% victim participation rate. That was 18 months after, they followed them for 18 months after they completed a contract. So we would come up with a contract that included restitution if there was any, and then just different things that were specific, just that it was tailored to the needs of that specific child. In terms of community service, restitution, therapies, time with family, we really identified, are you acting out because you need time with your parents, or what's going on? So it was really a good opportunity to identify the needs of that young person, and also identify the needs of the family, and then maybe some community things that were going on too. So I'm just wondering, have we not explored that again? And I think I brought this up before, and I've brought it up so many times that it was just a great program, and I'd really like to see it implemented again. We ran our program. We had 30 volunteers from WPD. I worked with Sheriff Easter with that. We had community volunteers, SROs, things like that. So, and then the juvenile district attorney's office, and then we met with the district attorney's office also. So it didn't require a whole lot of people that needed to be paid for it. I don't know what the budget was, but we ended up losing that contract and to somebody who bid lower. And then it was gone. So I didn't know if you were familiar with it, whatever happened to it, and were you planning on looking into maybe that as an option?
So I'm not familiar with like that specific jurisdiction's approach. Restorative justice is a really common model in juvenile justice. And so part of our discrete agency recommendations is to really look at the immediate intervention program, right, which is IIP, which is a required diversion for youth, and see how we can standardize some of the approaches across the state and ensure that IIP is actually being implemented in all of the jurisdictions, and then like have a menu of options that like these are best practice models. You know, I'm not sure exactly where it's going to go. We're still shaping up what that work could look like, but restorative justice is definitely something we would consider. Yeah.
Thank you, Mr. Chair. I was looking back on slide number 30, where it mentions 41% take psychotropic medications. Is that a normal percentage, at 41%?
You know, it's obviously very high for young people in a facility. Across states, you know, we do see that young people with significant behavioral health needs end up in juvenile justice incarcerated settings, like because of what we're talking about, because these early indicators weren't addressed or identified, and the young person's behavior is just escalating. And so then they end up like causing significant harm, and it's a combination of both, right? You guys have criteria around which young people can be placed in KJCC, but this is, I think, a pretty common, unfortunately, like trend we see across states, but we don't want to see this, right? Like.
So without early intervention, it goes just right to medication.
Well, I think early intervention would have been, you know, years before, right? And what's happening is that young people aren't getting access to effective community-based services, and so their behavior is escalating and intensifying, and then they get to facilities, and this is like how behavior is managed, right? Some kids obviously some kids need meds, and part of the problem too is upon reentry, kids aren't connected to community-based supports to maintain the medicine. They don't want to take it, right? There's all these like problems, so we want to figure out solutions that, you know, how do we make sure that the correctional complex is not the behavioral health facility, right? Like they're separate problems, so that's kind of the purpose of that data.
Can I go back to slide number 27, and it mentions about the 88% higher than the national average. The data ends in 2021, and it shows to be kind of going up just a little bit. Is that a continuing trend into 22, 23, and
I
24?
don't know. So these are data that Kansas reports to the Office of Juvenile Justice and Delinquency Prevention, and there's always a lag in the data that we're able to read. I'm not sure what 2022 looked like. I can see if we can get more on that, but yeah, I don't know.
And one more question. Sure. I can't find a slide off the top of my head right here, but it mentions about funding being returned. I don't know what slide that is. I think it's maybe 23.
I know what slide it is. It's 23.
I mean, is there a reason the money that's allocated isn't being spent?
So it's part of why we're viewing this from a cross-systems collaboration approach, because like, for example, KDOC is not a mental health provider, right? And while there is funding for this, it requires that there are services available in the community for them to partner with and then ensure young people can access them. And so that's part of it, is that how do we ensure there are services to actually fund, and also, maximize this funding. So that's why we're really working across the agencies together to make sure we're planning effectively, and also now develop this money, right? Like, because we don't want to stand up parallel systems. Like, we don't want a behavioral health system within the juvenile justice system. We want kids that have justice contact to be able to access specialized approaches from a behavioral health provider. So everybody's doing their part.
Thank you. Yes, Representative Mosley.
Thank you, Mr. Chairman. So, sorry, I don't know why I said but thank you for your presentation. Of the children or youth offenders, how many of them live in communities where because Kansas has not expanded Medicaid, there's about 150,000 Kansans, especially in our rural communities, that can use that. How many of them live in communities where there is not hospitals, they don't have access to the health care based off like recommended healthcare workers density per population?
I don't have a percentage of that specific item, but what we heard from listening sessions with people is, especially in rural and frontier counties, they have a very difficult time accessing any type of behavioral health service, and they are directed to a hospital. And we want to avoid hospitalization as much as possible when that issue can be resolved in the community.
Thank you. Thank you, Mr. Chairman.
Representative Butler.
Thanks, Mr. Chair. Thank you for the briefing. There's good statistics, and especially the information on early intervention. Those things are important. But it seems to me that through all this, those are all what we do for the effects of what's going on. What about the study of the cause of what's going on? And then once we get the cause, where's that coming from? Then we interject there. Do you know information about that, study about that?
So yes, there's research on, like the structural, environmental, all of those things that kind of influence justice involvement. And KDADS has a lot of like early, when I say early, I mean like 0 to 5, right? Like those types of interventions for parents and young children. But there's a gap for kids once they turn a certain age. And so we're trying to think about this from a perspective of once young people start to exhibit warning signs, how do we respond in an effective way and kind of address it before it turns into harmful behavior or they end up in the justice system? So we really want to prevent that. And so there's always a wide-ranging continuum, but we also have to have like parameters around the problems we're trying to solve. Otherwise, we go so deep into like systemic issues. And so there's a lot of research on that, but here we're trying to both respond to young people like right now and a little earlier. That's really the focus of this kind of assessment that we did.
Representative Smith, do you have a question?
Thanks, Mr. Chair. As we talk about the youth, are we talking about 18 years down, 19 years down?
Correct, yes.
18?
Yes, Whoever can be in the juvenile justice system.
Okay. I was going to say, on Medicaid expansion, it affects kids from 19 to 64. So these kids would not be in Medicaid expansion. Somebody correct me if I'm wrong, but I think it's.
Can you respond to that?
I'm not sure. I'm not
I'm pretty
sure.
sure that's the case. And, but we do have, instead of Medicaid expansion, we have a CHIPS program. Does that help with insurance or anything like that?
Yes, if a kid has CHIP, they essentially have Medicaid, right? So, yes, they would have coverage.
I have a couple questions if no one else on the committee at the moment wants to ask. So what I keep hearing from people involved in our Kansas juvenile justice system is that we have a problem with what I'll call mid-level offenders. And also what I call we'll call repeat offenders, people, kids who are in probation and keep violating, but it seems that our judges don't have sufficient discretion to handle those circumstances, and often the kids can thumb their nose at the system and just get away with it. And related to that is, what I'm hearing is that for these mid-level offenders, the choice is often, do you send them to correctional facilities, which is not thought to be a good idea, as your research suggests. And so the alternative is, sometimes that happens, not good. Then the alternative is to send them back to the community, either the family they came from, which may be very dysfunctional, or to a foster care setting. And then they infect, if you would, the foster care kids who are there just because they're sink kids. So did your committee look at that kind of question and come up with some possible solutions to those, what I call mid-level offenders?
That's really the population that we would focus on developing specialized approaches for, like around their behavioral health needs, their family conflict needs, and we see that there are gaps in those things, and that's why young people are like either escalating or repeating behaviors because they're not getting effective interventions. So without an intervention, it's hard for me to change my behavior, even if I'm being held accountable, right? Like by the justice system. And part of that is developing incentives and sanctions for probation officers so they can ensure that they are responding to kids' behavior. We don't ever want to ignore a young person's behavior, right? We want to have developmentally appropriate responses and consequences. So part of the early intervention planning is to develop a specialized approach for that moderate risk group you're talking about, because we see there's a lot of variation across the state about as to far as like what is actually available for those kids.
Right, and did you look at the foster care problem? Because we do have a big problem with their not being, they're DCF, they're dealing with, they're not supposed to be dealing really with juvenile offenders.
DCF has in statute, they have responsibility for young people that commit status offenses, right, which is like running away from home. They're like crimes that wouldn't be crimes if you were an adult, running away from home, not going to school. They are the agency that oversees those young people. And then they also are responsible for any sink youth in their care that exhibit warning signs of juvenile justice involvement. So they have those two buckets of kids. So that's why when we look at the early intervention, we want to see like what are actually the interventions we're using for these young people, what's working, what gaps do we need to fill. So that way we're intervening effectively if systems are going to intervene with a young person.
Thank you. Yeah, Representative Schlingenstiepen.
I just wanted to kind of raise a general sort of philosophic point. You know, often when we have these discussions, we have in the community over here, institution over here. Institution equals bad, in community equals good. And we've already, you know, noted, I think, in your testimony today that sometimes in the community is just an unhealthy, dysfunctional environment, and that there are no alternatives to that. And I spent some time living in Germany, and I was always fascinated by, you know, you asked about root causes. And there was one model I discovered there, I found it was fascinating, that, you know, people were paid to be professional parents. So in other words, the model was, let's create a family. And except foster family is one of those ideas, but foster families, regardless of training, are still people who, you know, have normal lives and all the rest of it. But sometimes these kids require a lot more because they don't have healthy family environments. So essentially what you're doing is you're, you know, paying two adults to be professional parents to 4 to 5 children or something like that. And what you're doing is recreating a family, I mean, the way it should be, as opposed to how it's often experienced. And then from there, you access services, and, you know, there's kind of immediate accountability rather than constantly tagging base A, you know, B and C and all the rest of it. And then this model even gets taken further. You know, there are group living arrangements in which, for example, young people, middle-aged people, and seniors are living together in a kind of apartment building where all of those folks get, for example, you know, rent deduction in lieu of services they provide to each other. And so what I'm suggesting, I guess, is there's something between an institution and just simply putting someone back into the context of the original mess that I would love it if somebody could model it and see what the financial difference is between, you know, running the gamut of services that often don't connect with each other. And where there's duplication and where, you know, that it all sounds good on paper and in the abstract, but in the concrete, what's really missing is reliable interaction with people on a very basic, everyday, familial style level that works and helps with all the access to additional services that certainly may be needed. I just want to throw it out there because I think it links some things that have been brought up.
Well, we did some work with Michigan a couple of years ago, and they have like a therapeutic foster care model for juvenile justice kids as well, so similar, different, but there are some things like that. I can't remember the continuum of foster care placements we have here, but, you know, that's why leveraging like Family First and family preservation dollars is also really important. Because like that young person is always going to be in that original family system, you know, that's still their original family. So making sure that we can like, and a lot of this is about working with the whole family and not just with the child if we can. And then that way we're supporting that whole system rather than the kid as an individual and then they're living in this kind of more, you know, complex environment. So I appreciate what you're saying.
Well, thank you so much for your presentation and standing for questions.
Yeah. Thank you guys very much for inviting me.
We'll move on to our next speaker. Welcome to the committee, Megan Miller. You're Deputy Secretary of Kansas Department of Corrections, and I'm sorry that I'm glad we got all that we got from the last speaker, but I'm sorry that it's cut into your time. But please,
Mr. Chairman,
please.
Committee, I will talk fast. And that was probably the most important information for you to hear.
But don't talk, seriously, don't talk fast. I'd prefer to understand what you say rather than just...
Yes, sir. Fair enough. Fair enough. I'm Megan Milner, Deputy Secretary of Juvenile and Adult Community-Based Services with the Kansas Department of Corrections. In my role, one of the things I get to do is work with the executive branch functions for the juvenile justice system in Kansas. And so I am here today to talk a little bit about the difference between detention services in Kansas and our Kansas Juvenile Correctional Complex, and then a few updates from House Bill 2021, which was passed in 2023. I wanted to provide you with some updates regarding the work that we've done with that. You should have a handout. Do you have a handout that covers? Wonderful. So Kansas currently has 9 juvenile detention facilities. You'll see that in the map there. These are locally operated. The Kansas Department of Corrections has no jurisdiction over these. They are licensed through the Department for Children and Families. We do not provide regular funding, with one exception that I'll talk about. We don't provide funding for the juvenile detention centers except to pay per diem rates for any of our KDOC custody youth who might be residing in detention for a sanction or something along those lines. Otherwise, juvenile detention facilities are completely funded by the local county or group of counties. The one exception to the funding was with House Bill 2021 that I referenced earlier. That authorized the Secretary of Corrections to ensure that certain services are provided in juvenile detention centers for juveniles who are there. And I'm going to provide a little bit more information about that here soon. The funding that we provide to juvenile detention centers are through grants to be able to support those services in their detention centers. Most youth who are in detention are awaiting some kind of court decision. So that may be an adjudication or a sentencing, or they might be awaiting a court decision on a probation violation, something along those lines. Some youth could be there on a temporary sanction, but most are awaiting a court decision. That becomes important when I talk about the juvenile correctional facility here in a moment. Typically, a youth stay in detention is going to be shorter than what you would see in a juvenile correctional facility because they're waiting for a court decision, and then once that court decision is made, they move on to a different location or possibly released back to the community. That's not the case with every youth. We've certainly seen some outliers where youth have been in detention for 1 or more years. And some of that is due to court processing and the length of time that it takes for court processing. So in regards to the juvenile correctional facility then, just as a comparison, we have one juvenile correctional facility in the state, which is the Kansas Juvenile Correctional Complex that's located here in Topeka. Different than detention, all youth who are at KJCC have been adjudicated by the court, and they have been sentenced to that facility for a determined amount of time, determined by the court. So the Department of Corrections nor KJCC determines what that length of time necessarily is at the facility. Because we only have one juvenile correctional facility in the state, KJCC serves both males and females, so we have both there at the facility. And this was referenced earlier, but according to Kansas statute, a youth can be adjudicated a juvenile offender if an offense was committed between 10 and 17 years of age. But statute does allow the Secretary of Corrections to retain custody of youth at KJCC to the age of 22 and a half. So we have a significant amount of young adults who are actually at the juvenile correctional facility. About 50% of the residents who are there right now are over the age of 18, and roughly, I have this percentage here, about 90% are over the age of 16. So we're dealing with an older adolescent, young adult population at the facility. In 2024, the legislature passed Senate Bill 420, which amended KSA 757062 to allow the Secretary of Corrections to establish a work release program or an educational release program for youth who are at KJ with the support of the legislature and the governor's office. This is the first time in a couple decades, at least, that we have had the opportunity to pursue this type of work with the youth who are at KJCC. So just a little update on that. We have not actually had any youth that has left the facility for this purpose yet. We've been very intentional and tried to be very methodical about how we do this. and how we, the policies that we put in place and the procedures that we put in place. So KJCC has a work group of staff that's comprised of security staff and our programs and reentry staff to build this policy. We're very close to having a draft policy, and then we'll be able to fully implement this. Stephanie mentioned in her presentation juvenile intake and assessment, so I wanted to go over that a little bit with you so that you're aware. And I'll go through this kind of quickly since we spoke about it earlier, but I'm happy to slow down and talk about any questions. So each judicial district in Kansas is statutorily required to operate a juvenile intake and assessment program. You will hear these often referred to juvenile intake and assessment centers. Kansas is so diverse geographically across the state. The different areas of Kansas look so different that it's important to note that not all districts have an actual center. Once you get to more rural areas of the state, this is actually a mobile service that a lot of judicial districts offer. So it's not always a standalone facility that you might see in the more urban areas. Juvenile intake and assessment programs are all county operated. These are funded through the Department of Corrections through state general fund dollars. And we allocate these out via grants that we administer every year to the judicial districts. We also establish the standards of operation for juvenile intake and assessment programs across the state, and then counties use those standards to build their own local policies and procedures. Juvenile intake programs are 24/7 services, so they are to be accessible and responsive to law enforcement 24/7. And so it's a very active service across the state. Stephanie mentioned earlier, it's sort of the front door into the juvenile justice system. Sometimes it can also be the front door into the child welfare system as well, because juvenile intake programs work with youth who are alleged juvenile offenders. They also work with youth who might be a child in need of care, but juvenile intake programs also can statutorily work with youth and families on a voluntary basis. It doesn't have to just be a law enforcement referral. The primary functions of juvenile intake programs across the state include screening and assessment, as well as referrals to community-based services that might assist the family with trying to divert them from deeper system involvement. In fiscal year 24, just so you have a little bit of data regarding juvenile intakes across the state, there were over 11,000 intakes in juvenile intake programs across the state of Kansas, with about 80% of those intakes being for juvenile offender reasons. The remaining were for child in need of care reasons, status offense reasons, and similar things like that. So moving on to House Bill 2021, which again was passed in the 2023 session. House Bill 2021 sought to increase collaboration between agencies and improve access to evidence-based programs and services in the community. So there's 4 different initiatives from House Bill 2021 that I would like to update you on. The first is from Section 1 of the bill, which authorized the Department for Children and Families to select a risk needs assessment for a child in need of care who might be exhibiting certain aggressive behaviors that could lead to juvenile offender charges. The Department for Children and Families chose the CAFAS, which is the Child and Adolescent Functional Assessment Screen. I believe I got that right. And they've been implementing that actually in their system for quite a while. We've been working on this particular process from the bill for about a year, a little over a year, probably about 14, 15 months. So once a youth is identified as potentially needing services by the CAFIS tool, House Bill 2021 allows the child welfare system to refer that youth to services that might be available in the juvenile justice system. That's typically through community corrections partners. They are the ones who are delivering those services locally in the communities. And so a child welfare or a case management provider can refer that youth to get services that might address some of those behaviors that could lead to juvenile offender charges. We've been working closely with the Department for Children and Families as well as the foster care agencies, community corrections providers to build this process. I have a little bit of data. We know that this data is not complete. We have some missing data from this. We're trying to refine this process since it's a little bit new. So far, there have been about 50 referrals from the child welfare system to the juvenile justice system. And by that, I mean a program or a service, not actually to the system. Of those 49 referrals, 35 were accepted or approved for services. Some of the reasons that some of those referrals were denied include youth moved. They might have moved to a new foster home or a new location, and so we're no longer eligible for services in that area. There wasn't possibly a program that would meet the need of that youth. Or the youth didn't meet the criteria for certain programs. So the majority of youth who are being referred are able to access programs through the juvenile justice system. We're continuing to work with DCF and the case management providers to make sure we're refining this process, answering questions, working through issues and barriers that come up to make sure that youth are able to access services when those are appropriate. I referenced this earlier about House Bill 2021 authorizing the Secretary to ensure juvenile detention centers are providing access to behavioral health services, mental health and substance abuse services. Just very quickly, we've released grants into the community. For that, we've selected an assessment tool that detention centers are implementing really at the booking process. They administer this assessment there, and we're able to identify who needs to go on for additional mental health evaluation or substance abuse evaluation. I also have a little bit of data related to that. From October through December of 2024, 358 youth across the state in detention centers were screened using this risk assessment tool. 83% of those were recommended to go on to get a full mental health evaluation, excuse me, and almost 60% were recommended to go on and get a full substance abuse evaluation. And the reason I want to point that out is because it really just demonstrates the needs of the youth who are being detained in Kansas. So a large number of youth who are in need of mental health and substance abuse services. Some of those services are able to be provided in juvenile detention centers. As I mentioned earlier, the length of stay in detention centers is very fluid because of all of the different factors involved. So some youth are able to access those services while they are there, some release prior to being able to access those services in the detention center. House Bill 2021 also instructed the Department of Corrections to work on a grant program that would be a rolling grant program that would allow community providers to access services to grant funds essentially anytime during a year instead of just at one point during a fiscal year. We have implemented that. So right now it's about 4 times a year. We are working to refine that process so we can do it even, we can release those funds even more often than that. So far, since we started this, we have released just shy of $5 million through that particular grant process. And finally, the last thing I want to share with you from House Bill 2021 was a requirement to build or develop a system that facilitates the exchange of data between child-serving agencies so that we can really streamline the services that youth are receiving in the state. We've attended several demos with different vendors, and we have not necessarily purchased a system, but we do have memorandums of understanding that exist between the Department of Corrections, DCF, and OJA. And these are all data sharing agreements, and we are exchanging that data regularly. Some of the challenges that we've had, all three of these agencies involved have embarked or are about to embark on a new data management system. So the timing of that has been a challenge, and we're continuing to find ways to improve our data sharing between all of the agencies. With that, I'm happy to stand for questions.
Thank you. Does the committee have any questions for the Deputy Secretary? Representative Carmichael.
Thank you, Mr. Chair. Thank you for being here. Your testimony has been quite instructive and helpful and answered many questions that I had. Our last conferee from CSG testified about a task force report, and it looked to me like there were at least 2 members of the task force that were from Kansas Department of Corrections. I'm not sure that KDOC would agree with all of the conclusions contained in the task force's report. I don't know. So make it simple. Do you all agree with everything that she just had to say? Because based on my limited experience, I can't agree with it all.
Mr. Chairman, Representative, thank you for the question. The Kansas Department of Corrections has had the opportunity to review all of the recommendations that you have seen today and the full report. We would agree that there are still a lot of improvements that we can make in our state, especially around the youth who are touching the juvenile justice system. We are in support of the recommendations from the Council of State Governments.
I'm surprised, but you just made my job easier. I'll rubber stamp it if you will. Thank you, Mr. Chair.
Representative Smith? No? Nothing? Yeah, please.
Mr. Chairman, I think on the second page, under the KJCC population graph, you have 2024 Senate Bill 420, House Bill 420, but you said Senate Bill. I assume because of the numeration, that should read Senate Bill. Is that right? That's right. But it says House Bill on this handout. So I just wanted to point that out, that it's right under the graph, the first bullet point under the graph.
Yes, I apologize.
You said it right. I just wanted to make sure that I was.
Yes, thank you for catching that.
Are there any other questions? Okay, well, thank you so much.
Yes, sir. Thank you.
And once again, no meeting tomorrow. Have a good weekend, and we'll see you Monday.